Okay, Elvis is calling the names according to the way that he's registering them. And then we give them the numbers.
What does the number look like?
The number is 4 numbers, 0001 up to 0040. So when we reach 40, then we stop giving the numbers because our target for the day is 40.
Okay, now I'm registering the client. I'm taking their personal details such as date of birth and initials and giving them the numbers.
Okay. And is this anonymous?
Yes, our testing is anonymous because we don't take personal details such as full names, the name, ID numbers, and street addresses. We only ask for date of birth and initials.
Okay. Thank you. Okay, so what are you doing?
We have a form here that's given out by the Tutu tester.
Okay.
On the form here, there's several different fields, which is filled out relevant to the patient. Name, age, weight, sex. What we do here is we then take this form here and we'll capture the data.
Okay. So what are you doing here?
We take the information off of the form, which is basically the gentleman's initials, his mobile telephone number, where he lives, and his date of birth. And for those who do not have a mobile cell number, we basically give them a starter pack. It's basically just a SIM card that enables them to then put it into a telephone and receive information which might be sent to them by the Tutu tester. So then ask the client to take his fingerprint. So Buti, can I see your hands? Can you use with this finger? Like this. And you just push it down. Yes. Okay? Go for it. Push. Up. Let's try it again. Okay. Perfect.
Why do you do that?
We then receive, this is a biometric data capture of the person's fingerprint, which is a unique print.
It keeps it anonymous?
It does keep it anonymous.
Then what happens?
We then enroll this patient into our database, where when 2 stickers are then allocated and printed out. The first sticker will go directly onto the patient's form. And the other sticker will go directly onto the patient's chest here for a visual authentication from the nurse.
Okay. Then what happens?
We then take also a picture of the patient. And there you have a picture of the gentleman.
I'm taking weight from the clients before they go for the height, and then so that we can do the BMIs.
Okay.
56 weight.
What we are doing here, we are taking weight and height and BMI, body mass index, and then we see if height and weight is balanced.
So what happens in there?
Okay, what's happening in there? We are doing the actual testing. The clients, after they are done in the tent, they go in for the actual test. We've got 1 nurse and 1 doctor who are doing the actual test in the van.
What tests do they do?
They are doing HIV, hypertension, diabetes, and sexually transmitted infections, and they do those tests simultaneously. They do the finger prick ones, and then from the blood sample they do on, and our clients get their results within 10 minutes.
All sick. EOLSIK. Is in this room? I test people
For?
with for HIV, high blood pressure, blood glucose, and find out if they have TB or STI symptoms. If they are positive in any of those things, I write them referral letters. If they have symptoms, I examine it and I advise them as to what it is and what they should do about it. I refer appropriately. If they are HIV positive, I do a staging examination and I do a CD4 right here so that the patient can get on the spot CD4 readings.
What is a CD4?
A CD4 is the amount of white blood cells. These are the cells that are depleted when you become HIV positive.
As I sit down,
Yeah. Tell me what happens here.
okay, this is a counseling room. We do the counseling session, the post result after the client is coming from testing, then I provide the results.
Okay. So what sort of counseling do you give them?
We do the risk reduction counseling, where we try to pick up some behaviors that could lead them to contracting HIV and STIs. Some of them need to work on those behaviors, but they can't do them on their own. So we are working around on what they can do in order to help themselves.
Okay. Thank you.
Thank you.
So we have a patient that's just finished testing on the ban. And he's come back to us to authenticate his profile to then be allocated a voucher which he will then redeem.
Okay, so what happens?
We'll ask the patient to put the finger back onto the scanner. Can you put your finger back on there? Okay, no, that's great. And what we'll do is we'll identify it here.
Yeah.
And then you'll see that there's a pattern that's picked up in pink. Which means that it's been authenticated to his number.
Okay.
We will then print out a voucher right here, and we'll print it out for him, and it will come out on the printing machine.
Can you show us the voucher? And what does he do with that?
He will then take it to one of the field workers from Men on the Side of the Road and go redeem his prize.
So Elvis, what are you doing?
I'm paying them.
What does he have to give you?
He have to give me the voucher, and then I gave him 75.
Okay.
Thank you. That's all right.
Thank you.
Okay, buddy.